I'll touch on some of the things from our Ontario Health and some of the other measures that the government is doing. If I could get everyone to mute their mics for me while we're having a discussion, I'd really appreciate that. Thank you, everyone. For those who haven't been on one of the WebExes so far, if you move your mouse down to the bottom section of it, you'll see something that looks like a person with 3 lines. If you click on that, you'll see all the participants. You'll see your name listed there. You can mute yourself from that. You can unmute yourself from that. You can also raise your virtual hand from there. I'll give about a 5-minute statement to start off with, and then I'll open up for questions. If I could, I would prefer to have people raise your virtual hand to let me know that you have a question. When I acknowledge you, please unmute yourself. I don't want to get in a position where we have a number of people trying to talk over each other because they've got their mute or their mics unmuted. As I started off with, there was some very sobering news today, both from Premier Ford and from Ontario Health. And I'll start with some of the projections. We were looking at a possibility of 100,000 people potentially dying in Ontario from COVID-19 if we hadn't taken any of the measures that we have started to take. We have enough data now that we can do some projections on where things are going based on what we have done. Our projections for the end of April, had we not done any of the things that we have done so far, we would be looking at approximately 300,000 people infected with COVID-19. And we likely would be in the neighborhood of 6,000 of those people from Ontario dying. We made a number of changes beginning on March the 12th with the closure of all of the schools. With the changes that we have implemented so far, if everyone abides by the social distancing, the physical distancing, if everyone abides by the self-isolation, we would be looking at approximately 12 to 13,000 cases of COVID-19 in Ontario by the end of this month. We would also be looking at, we would be looking at 80,000 cases by the end of this month, with approximately 1,600 people dying. Unfortunately, many people have not been abiding by the physical distancing, have not taken it seriously, have not followed the self-isolation. Ontario has been forced to do more so that we can bring these numbers down. There were more measures announced today. I'll get to those measures very shortly. We have to take this seriously. I cannot emphasize it enough. We have to take this seriously. We're now projecting with the changes that we have put forward today that we'll be looking at somewhere in the neighborhood of 12,000 to 13,000 people infected in Ontario by the end of April. And in all likelihood, we're going to have 200 citizens of this province die as a result of this disease. I can't emphasize enough the need for physical distancing, the need for social isolation. If you have any symptoms at all, stay home. Do not go out. The risk of the people of Ontario is just too high. We're in a situation right now where it's not about you as an individual. It is about everyone in this province. And we have to be looking at the safety of everybody in this province. Some of the measures that we have put out, we have reduced the number of essential businesses from 74 down to 44. Construction has been one of the biggest concerns. In terms of construction, what has been deemed as essential moving forward is construction for hospitals, for anything that is related to the medical services, roads and bridges that need to be repaired in order to keep things safe. Residential construction that is near completion can continue, but there can't be any new residential construction started. All other construction is being deemed as non-essential. It's to stop. Municipal projects will stop. There will be some exceptions made to it, depending on what the project is, where it is in terms of being completed. High-rise residential will stop unless it is at a point where it can be completed very quickly. In terms of supply chain, our supply chain must remain intact. Food services, agriculture, courier services are part of the essential services. Funeral services obviously will be as well. Veterinary services for the health and well-being of our pets, but not cosmetic purposes. Home care will be allowed for up to 6 children in a home, with the home care provider, or the child care provider being part of that. We've had a lot of people ask us questions about seasonal campgrounds. They are not an essential service, and they must be shut down or they must not open. We cannot have people traveling to their trailer on weekends. It is not an essential service. Manufacturing will remain as an essential service. And any construction that's being done on any of the manufacturing facilities that are being ramped up for our healthcare side. Anyone that is doing a retrofit to help with our PPE, that will be allowed. These are some very serious measures that we're taking, and Premier Ford recognizes that a very large population of our workforce is being asked to stay home. I think Premier Ford's comments earlier today emphasize it very, very well. What is the value, what is the cost of someone's life? Is the cost of someone's life the equivalent of you going out with your friends and having a few beer in the backyard? And the answer is no. Is the cost of someone's life going down to a store that is not an essential service and buying something because you saw it online and you thought this would be the thing to buy? And the answer to that is no. Is the cost of someone's life having a social gathering like a wedding? And the answer to that is no. We have to recognize that this is about the people of Ontario and protecting as many people in Ontario as possible. We cannot find ourselves in a position where the trajectory for the number of people who are going to die is going to increase. We want to avoid the situations that we have in other countries like Spain, like China, like Italy, and even like the United States. Ontario is in a place right now where if we do the right things, we can mitigate the number of losses. We can save lives. Premier Ford made a statement earlier today that if we continue on the trajectory that we are, 1,600 people in this province will die before the end of April. And we have an opportunity to save 1,400 lives by making these changes. What everyone needs to ask themselves as we move forward is the action that I'm going to take are the things that I'm going to do because I want to do it. Am I contributing to the death of 1,400 more people in Ontario or not? I know it's a very serious thing that we're talking about, but I'm actually going to quote something from a movie because I think in this case, it's very valuable. And if you recall back to Star Trek II, The Wrath of Khan, in the scene where Spock dies, his statement is, the needs of the many outweigh the needs of the few or the one. Think of the needs of the people of Ontario. I'll open it up for questions now. Anyone who has a question, please raise your virtual hand for me. Mr. Barker, if you'd like to unmute yourself, please.
So how is this going to affect the Peterborough area? Just to put it out there.
Peterborough is going to have to close down a lot of the businesses for a short period of time. What Ontario is looking at is how do we keep these businesses in place? How do we keep these businesses open long term, recognizing that they're going to be closed on the short term? We're going to see a number of companies that will have to close their doors for a period of time. We're expecting that between the measures that the Ontario government is doing and the federal government is doing, that most people will still be able to cover the cost of their bills. We recognize that this is a very difficult situation for a lot of different people, but ultimately it comes down to the question of what is the value of someone's life? And we have to make sure that we don't have 1,400 more people die in Ontario than can be stopped. If you have a follow-up question, you're more than welcome to ask it.
I'm good right now. I'll let anyone else that has a question go.
Thank you. Bill.
Just one question. And because I didn't get to see his whole Mr. Ford talking, did he give any indication how soon these new changes will come into effect for these businesses?
Midnight.
Okay.
They take effect as of tomorrow. Are there any other questions?
Not from me. Thanks.
Okay, I don't see any others. Thank you very much for your time. Mr. Barker, you have another one?
Yes. Are there going to be any further precautionary measures being implemented, especially around old age homes and stuff like that?
So Minister Elliott has talked about that, and what she has said is that we need to put up basically an iron curtain all the way around all of our long-term care facilities and our nursing homes. This is a group of people who are in the group that is essentially the most vulnerable. In terms of measures that are being put in place, basically all long-term care facilities and nursing homes are in a position now where they're essentially locked down. We're not having visitors come in. They're limiting the number of people who do come into the facility itself to try and mitigate the risk that we have there. We recognize that there are still some people who have to come. Food services, for example, will need to continue to deliver it. And the healthcare providers that do work in the long-term care facilities, they will be coming in and out from their shifts. We're asking them to take every precaution possible to make sure that they don't put themselves in the position where they have the opportunity of picking up and becoming a carrier of COVID-19. It really comes down to, across the board, for every industry, for every person, thinking about what can I do to make sure that I'm not carrying that disease from one person to the next.
And just one final question, if no one else has any.
Sure, go ahead.
If people don't stop coming within those 2 meters, are you willing to go to Premier Ford and request further isolation steps, I guess?
Premier Ford has been very clear that nothing is being taken off the table. Whatever measures we have to do, he is prepared to implement those. If we look here in Peterborough, as of last night, when the social distancing, the social gathering restrictions were put just a couple of days ago to reduce it to 5 people. Last night, some individuals were playing basketball. They were warned by the police that they had too many people there. Basketball game broke up. 4 of the individuals who left returned basically after the police left. The police returned and charges were laid. We can't emphasize it enough. The virus has no means of traveling. It moves with people. If people stop gathering, if people stop moving around, the virus has no opportunity to move. We need to kill the virus in its place by not having people interact with each other physically. Do not go and visit your friends. Do not have a pickup game of basketball or hockey. Stay away from people. If you get within 6 feet and they are a carrier, you have an opportunity of having the disease come in contact with you. Do not go near people. I can't be any clearer than that.
Thank you. Just one final, sorry. Now, can you tell me if there is any businesses in the Peterborough area that are actually retrofitting to actually produce PPE? And who are they?
We have a number of businesses that have gone through both the Buy Canada website set up by the Canadian government and through Ontario Together. And there are companies that are in various degrees of it. One of the challenges that all of the companies face is they have to be authorized by Health Canada before they can actually produce the product and have it sent out to the different supply chains to get it to the people that we need. I know there are some initiatives with some individuals who are trying to do the right thing, and they're building face shields, for example. It's a great idea. It's going to help some of the individuals that they know. It's going to help a small population of it. But ultimately, it's got to be approved by Health Canada in order for our frontline workers or our healthcare workers to use it. We do have some companies that are very close to being approved. I'm not sure that I'm prepared yet to name them, because if they don't complete what that final requirement is for Health Canada, or if they're not able to meet that final requirement for Health Canada for various reasons that may be outside of their control, I don't want to have negative backlash for them from people saying, why didn't you do it? What I will say is we have some companies, some additional companies who are very close to being able to provide hand sanitizer, sanitizing cleaning products, like the sanitizing wipes that many people are looking for. We have at least 3 companies that are very close to being approved by Health Canada. They have a couple of hurdles that they have to pass. We have a company that is making different protective equipment, not just the face shields, but other types of masks. I don't believe it's the N95 mask. I believe it was just the surgical masks, but that is something that we definitely need to have as well. They are in the final stages with Health Canada to get approved. We have a lot of local companies. We have manufacturing power still in the greater Peterborough area, and those companies have all stepped up, and they are in the stages of being approved. Across the province of Ontario, we have more than 600 companies who have been approved, and we have more than 1,500 that are in different stages working their way through it. Our belief is that Ontario, in a very, very short period of time, will become self-sufficient for all of the personal protective equipment.
Awesome. Thank you.
Are there any other questions? All right. Sorry.
Just wanted to say thanks.
Thank you very much, everyone, for coming. I know it's a very trying time. Please do everything you can to stay safe. Please do not go out unless you absolutely have to. Thank you very much for coming, and God bless each of you.